Universal health coverage is about ensuring that all people, irrespective of socio-economic circumstance, can equitably access the health care they need without suffering financial hardships or financial catastrophe. This is the cardinal principle to improving the well-being of a country's population.
Throughout the development process of this policy framework, we have examined what the definition of UHC would be for our country. We have assessed where we are in the journey towards universal health coverage and what needs to be done to achieve progress in the attainment of universal health coverage in Namibia. So the situational analysis that have been carried out tell us that there are many key strengths in our system that we should maintain and that we should advance, as well as the bottlenecks that have been identified that we need to address and overcome.
The universal health coverage requires that services should be available to all people who need them.
We, as a country, can say that Namibia has fared fairly well in ensuring the availability of healthcare services. Through the primary healthcare approach, we do provide access to essential healthcare services through a clinical referral pathway, starting from the community to tertiary healthcare services at national referral hospitals. And I'm glad that yesterday there was a discussion on the essential health services package, which basically tells us what type of services ought to be available at each and every level of health care. So the referral pathways that we have do provide linkages and ensure that services are provided where they are needed by members of the public.
76 Namibians live within a World Health Organization's recommended 10-kilometer radius of a health facility. Nangome says there is a high service readiness at the facility level, with the overall health worker to population ratio consistently above 3 health workers ratio per 1,000 people in most regions. The Ministry of Health and Social Services recently submitted a cost plan to Cabinet for mobilization of additional funding for critical activities and interventions for health systems strengthening over the period of 2023-2024 to 2027-2028 financial years. Johanna Urikos, NBC News, Windhoek.